Now they're doing mass involuntary killing by hospital staffs, and they intend to implement that around the world. They are openly talking about getting this going around the world through this testing facility, killing testing facility called the Marie Curie Hospice.
Right. From what I understand, you actually made an intervention today in the D.C. area, intervening on this interface of what the British are doing, actively promoting in Britain, and how they're trying to import it or export it into the United States under the Obama administration. So tell us about that intervention. It sounded like fun.
Yeah, the pilot program for this was put in 2003 and 4 by Simon Stevens, who was Tony Blair's Minister for Health Care Reform. When Prime Minister Blair stepped down in 2007, this same Simon Stevens, who works for Prince Charles's King's Fund, came to America, got in charge of the AARP health insurance programs, and became a top executive of the private insurance industry. His organization is called America's Health Insurance Plans. That's the trade association for the HMOs and the private insurance companies. That group is holding a conference now, today, in Washington on how to cut Medicare. And I was there this morning. A strategist for the HMO cost cutters, Stuart Altman, gave an overview presentation on how to cut Medicare and why you have to savagely cut this or you're going to end up with needing wage and price controls. So I asked this guy from the floor about the Liverpool Care Pathway, the deep sedation that they put them under and the withdrawal of hydration and food that kills people with involuntary euthanasia, and that this was instituted by his colleague Simon Stevens. Isn't that what he's trying to bring here today? He was speaking to a group, maybe 1,000 health insurance executives, and this guy himself is a millionaire executive of many different, director of many health insurance companies with stock options up his rear end. And he said to the people, you see, I have to put up with these nutballs. And he said, you, not we, are killing people by demanding that we continue to put through these wasteful procedures.
Right.
He cited his friend Jack Wenberg's studies over years, phony statistics showing that most of the procedures that keep people alive are wasteful for frail elderly. And these people in the audience cheered and laughed when they heard this. He said that he told them, you are hated because of what you do. You lie to your families about what you do. So your children don't go to school and tell them, you know, my father is an HMO executive, because the public despises you. And just like a Nazi SS officer trying to put steel in the spine of his nervous troops, this guy said, you have to persist now. You have to resolve to push through the Obama administration this savage cost-cutting in the healthcare reform. That's what it's about. And you have to also resolve to redouble your efforts to do in the private health companies your so-called managed care in the face of this public hatred of you.
Right, the public opposition to having their lives sacrificed.
Yeah, and the public hatred of the HMOs.
Right.
And that's what the Obama program is. It's the HMOs and the financiers behind them demanding blood to bail them out. That's all it is.
Right. And it's clear that to this crowd, this is they're not interested in health care, providing health care, but it's a means to an end to them.
Yeah.
And that's what's got to be made clear.
Yeah.
And has to be introduced into the healthcare debate. So, thank you. Thank you for being on the show.
Okay, I think we may be speaking to these people again.
You think so?
I think so.
I hope so. All right, thank you, Tony.
Thank you.
So the point is that the authors of this healthcare reform, it's not about healthcare. It's simply a means of an end, and so that people who are calling this socialism, or people who are opposed to what Obama's doing, now with Tony's help can actually identify this as the British Empire. That's what we're up against. It's actually pretty simple. If there's not a bankruptcy reorganization of the type that LaRouche has prescribed, this bankrupt monetary system will simply cannibalize on the population, which we can see a clear propaganda campaign for underway with articles like Newsweek's latest. It's called The Case for Killing Granny. So those of you who oppose what Obama is doing recognize that it's not socialism, this is fascism. So what we've identified the problem, one thing that we need is a population who knows what to demand, which is uniquely spelled out in the latest paper written by Lyndon LaRouche, Economics is History. So thank you again, Tony, for joining us.
Thank you.
This is Alicia Saratani signing off. Good night.